Okay, hello. Welcome to another episode of Facebook Live. We're super excited to be with you, and we are the Dr. Simple. And so today, Lauren is going to join with us and talk about her perspective about identity foreclosure. I told Lauren that is a big couple of words, and so I'm so excited to see what she has to say. Because I'm just a girl sitting next to some fat and some probiotics. All right. So as far as old news goes, we love working with our awesome intern team. They are fantabulous, and we're super excited for all the new ideas and projects that we're developing and gonna continue to hopefully bring wellness to you over the next several months. And I make my list to keep me on track because my mind kind of wanders at times. And so don't forget about our special until Valentine's Day about lips and libido, helping with lips and then also helping with libido. And so it is $50 off for lips with Carrie. Mm-hmm. And then as far as libido goes, for one person, one package of a FemiLift or one package of a Gains Wave, you get $100 off, but double your fun with your partner and you each get $200 off your package because both of you guys should have a great day. So that's super fun to know. And then, let's see here. Oh, and then last night I had so much fun going to Boxing with Dre. And I just want everyone to know that that class is super awesome. So I can't wait to go back. And I just wanted to thank him for so much fun. Now, our supplement of the day is our awesome probiotics. Because Lauren was bringing this up that, so many people are getting sick with the flu or they're having an upper respiratory tract infection and they're taking antibiotics. So we think, we take that antibiotic and we start to feel good. But you forget about your gut flora, right? So you take your antibiotic, you wipe out your gut flora, your head gets better, and then you get diarrhea. Not cool. So what happens is if you take your probiotic, when you're taking your antibiotic, then you seed your gut flora with the happy ones. So if you're already taking a probiotic when you're on your antibiotic, and always have been one, you want to double your fun and take two. So for Lauren, who was having an infection, we were like, we can take some of the orthomolecular probiotic 225. This is their brand that you use if you have like ulcerative colitis or Crohn's disease. It's just a couple of the other probiotics but in a powder, and it tastes pretty awesome. So then what happens is your tummy doesn't feel so bad, you don't feel so bloated, and you don't have such bad diarrhea. Plus, the other thing you should actually think about is the fact that sometimes if you're sick and you take your antibiotic, then you just seed your gut with yeast.
Yeah.
And then you're bloated all the time, your sinuses get all clogged up, and your ears itch. That's totally uncool because that stuff will stick with you for a while. So who needs that? So don't forget to take your probiotic when you're on an antibiotic, or really just always take a probiotic. And the thing I love about the orthomolecular brand is it's freeze-dried, it's easy, its shelf life is a long time, you don't have to keep it refrigerated, and it doesn't taste bad, and it's effective. So, yay, what a win.
Also, we mentioned that some folks don't know where they can find probiotics. They think, I can only, eat yogurt.
Yep.
So for somebody on a prescription medication like myself, and you're not supposed to eat dairy in around a window of taking the medication, you think, where am I supposed to get this from? Orthomolecular, huge help.
There you go. So we love our probiotics, and we have them for anyone that needs them. And yay. And it's FDA regulated, so you know that they really are what they say they are. So that's comforting too. Yes.
Very comforting.
All right. So now we got to the supplement of the day, and the procedure of the day is Lauren, because she rocks. And so she, again, is going to talk about this identity foreclosure. And then after that, I'm going to talk about a subject near and dear, which is menopause, because it's just super fun. And if I get too wordy, everyone can lift up their hands and tell me to slow down or go back or just quit. So feel free, if you have a question as we go through things, write it down, and then we'll take questions at the end. So let's hear about Lauren and identity foreclosure. Okay.
Yeah, absolutely. So Dr. Durland and I were recently talking about folks who come in, and sometimes younger folks who come in, who talk about kids in sports. Specifically, their kids in sports at a high school level where it's very competitive now. There might even be pressure for sports specialization. And we find that when student athletes are in a specific sport for a long duration of time and they don't take rest, or they don't get enough of a time to let their body kind of reset and recover from a difficult spring or fall season, that they're really at risk for injury. But so that comes from the physiological standpoint. But what also can be difficult for a young athlete, especially one in their teenage years, is when they're kind of forming their identity. They're figuring out who they are and their place in the world. So a big thing that comes up is if you're very specifically focused on one sport, maybe your end goal is, playing in college or playing professionally. And in this pursuit, you end up devoting all of your time. And it starts to perpetuate this idea, or you start to get engrossed in this culture where if you are not devoted to playing this sport, being in this sport, practicing for the sport, training, watching film 24/7, then you're not committed. And we know that can lead to some really difficult ideations about the world around you, because first of all, you start to miss out on just basic social interactions that you might not have if you're constantly in practice, constantly in season, constantly traveling. You might just be kind of cornering yourself to that experience. So we know that can be really difficult for identity development. Second of all, if God forbid you get injured or experience something related to an end to your career or your season, that can be really detrimental to a young teenager who isn't quite sure who they are outside of their sport. So that's kind of the idea of identity foreclosure, is committing to something, whether it's an occupation, in this case we talk about a sport, very early on in life, and kind of surrounding yourself and immersing yourself in that culture, and then believing, I am truly this sport, I am a soccer player, and that is what I'm going to do for the rest of my life. So we talk about how that can be dangerous. So we talked, Dr. Durland and I have talked about how working with folks who are in high school sports who might feel that way, or parents who might feel like their kids are experiencing that, it could be great to talk to someone just about what it's like in that culture, and how to really start to develop your identity and start finding value systems that might be outside of that sport culture. So that's kind of the idea of identity foreclosure, is kind of quartering yourself in. So this kind of blends into the idea that the whole 100% commitment to a sport, simply doing it over and over, simply burning yourself out truly leads to greater success. And we know that's not the formula for meeting some of those goals, or playing at a collegiate level or playing at a professional level. That balance and being able to find that value system and those likes outside of that sport are really, really important.
And I actually woke up last night thinking a little bit about this, because I do that from time to time. And I was just thinking, I'm like, like we talked about, I think it was last week, that we're all here for a reason. Whether you play soccer, whether you play football, whether you play basketball, whether you're a lawyer, whether you're a garbage man, whether you work at Walmart, whether you work at Dillard's, whether you fix cars, like, who cares? Everyone is here for a reason. And we all are on the team of this adventure of life, and we all have a purpose, and the stronger we all are together, the better all our journeys are. So to learn and look at yourself outside of just one part of yourself is just super valuable, because life is dynamic, it's always changing. And if you believe you're here for a reason, then it becomes less easy to get hung up on these adventures of life that otherwise can be kind of hard. So it's just great to know that there's help out there, that it's okay to talk about it, and that hopefully the team even gets stronger when we realize that there's more than just one way of doing things.
Yeah.
And I thought of another couple things before I get to the menopause thing. And one of the things actually was, I wanted to give 2 patient stories from the week that I was super jazzed about. One patient actually has what's called lichen sclerosis. So lichen sclerosis is where you get this hyperkeratosis of the labia, and so I kind of think of it almost like psoriasis of the genitalia. So it itches really bad, it burns really bad, it's red, it's cracked, it's unpleasant. And so the typical treatments are just topicals all the time, and people live with this actually for decades. Could you imagine every day walking around with your labia being itchy? I mean, that is just not cool. Poor Lauren here's like, didn't even know that happens. I've looked at about 1 million labias, so I'm very well diversified in them. I see them a lot. So anyway, when I was in my classic practice, again, all we had is topicals. But now I've been injecting PRP and doing laser. So I have this really cute, amazing, wonderful woman that comes in, and we lasered it. And you know what? It was awesome. She's doing great, and her labia is fantabulous. And she didn't use her topicals, and her labia's not burning every day. And do you know how exciting that is to be part of that journey? So I'm just here to tell people, if your labia is itching all the time, and if you have lichen sclerosis, that there are some other treatments that you can do, and maybe your life could get better too. So I hope that just gives someone hope somewhere, and yay. And then the other thing I was going to say, I was so super pumped about the other patient we saw today, and that she came in and is eating more protein, she's moving, she totally logs in, gives Lauren her steps every day, and she's rocking it, right? And Lauren, being the awesome, positive person she is like, you got this, and gave her like positive thoughts on her water bottle to encourage her to drink water. I mean, she's amazing. So do you know what happened on her body comp today? Oh yeah, her muscle mass went up by 3 pounds and her body fat went down by 2.5 pounds. And that was in a month. And so the interesting about that, because I even brought her body comp here, is she actually gained a pound of weight, but she gained muscle and lost half of this in fat. So it was a great example of how your BMI was not predictive of her being healthier. Her weight actually went up, her BMI went up, but she feels better and she's becoming a stronger, leaner version of herself. So it was an attestament to just don't listen to the scale, listen to your body. And when your body feels unstressed, your muscle mass will go up and your body fat comes down and you feel great and your body will look great as you continue on that trend. So kudos to that lovely gal, kudos to Lauren, kudos to people getting better. So that was great. And now we're going to talk about menopause.
Okay.
All right. Did you have another question?
I had a point. But
Go for it. No, you go first.
I was just going to say, I think it's a testament to the culture you create here and the supportive staff, and I think someone's commitment to the process and just believing in themselves, believing in us, believing in accountability, because not everybody wants to check in every day, for example, but this for her, we just figured out a formula that really worked. Yep. What makes you happy? And what makes her happy is reaching her step goals. And then once we're started to hit those in a consistent basis, she talked about her goal of drinking more water. And we just talked about different ways to drink more water. Okay, this particular individual is really just like thrives on challenges, personal challenges, like her one-on-one to herself. And so she just challenged herself to drink X amount of water at a certain point in the day. So marking her water bottle. So just simple behavior changes that just take, a couple minutes to think about. And sometimes it's just about getting that confirmation with someone that like it could be a good idea, or it could be, and so that's what we're all about, trial and error and just finding out what works best for you. So I think that speaks to how you've helped, kind of create that culture. And
it takes a village, and it takes everyone. Yeah, Lord freaking rocks. And it's also super fun to look at people's body comps and watch their once your body fat starts going down and your muscle mass goes up or stays the same. I tell them all the time, I'm like, oh, I'm so pumped for you, because now all you need is time. You just need to keep doing the same thing because you're rocking it. It gets hard sometimes to move your body till you start to figure out the formula of what it needs to do that. But once it does it, I know when your body's moving, you feel clear-minded, your sleep is good, you've got great energy, and you believe the world's a better place because your body wouldn't move until your brain's in that place. So it's just, again, fun to be part of people's journeys.
And finding success in different ways besides the scale.
Yeah.
So finding success in I reached my step count so many days in a row. Finding success in I was able to drink this much water. I think just some of those small incremental changes, and then you start to see the results in different ways. In some ways it's in the scale.
Yep.
So
super fun. So the reason I'm talking about perimenopause and menopause today is it seemed like lots of people wanted to talk about it. So again, I could talk about this over and over and over because it's so super fun. And I tend to make analogies of what I see when I drive down the road because it makes it easier in my head. So anyway, I'm just pre-apologizing for the analogies I'm about to create here. So when you think about menopause, the definition of menopause is no periods for a year. It's just when your ovaries have let out the last egg. Now, every woman is born with about 20 million eggs at birth. And can you imagine out of that 20 million eggs, how many offspring we have? So I look at my kids all the time, I just think, oh, you guys are super duper miracles, because out of them, you're the 2 guys. But plus, you extrapolate that about how many millions of sperm per ejaculate there is, and again, we're all miracles. Every day we should ponder that. Anyway, okay. So then what happens is we go through puberty, right? Puberty happens in our early teens, maybe a little earlier for some people. And then we start having, like cycles maybe every month-ish. Now, birth control pills, honestly, were designed by people, not because every 28 days is what a woman's always supposed to have, but I think literally they sat around the table and thought, a girl has a period every 28 days. So if we give her birth control pills, let's make them for a 28-day cycle. That's as scientific as it actually got. So, it's just interesting to think that way. But as we get to 40, what happens is our egg reserve starts going down. Because if you're born with your eggs at the time of birth and they're with you your whole life, they're exposed to every single pathogen, every single mutation, everything our whole life they're exposed to, right? But guys, they're making sperm every 3 months, so they don't have the same thing happen to them that we do. Well, it makes sense when you go through menopause that we don't have it, we're not procreating then because our eggs are not as healthy, right? So for the animal kingdom, if we procreated, they may have more genetic abnormalities. But it doesn't mean when we go through this period of time that we're not worthy to society, to culture, or to ourselves. Now, the other thing we have to know about hormones is hormones help your body with stress. They just super do. So when I went through medical school, menopause was hot flashes are gone, we're all supposed to have a great day. Well, actually, it does more than that. So the other thing, you just ask your friend, ask your neighbor, ask your mom, ask your sister, ask someone what happens when you go through menopause. We gain weight. So why do we gain weight? It is because it is a time of adjustment of the stress response of your body yet again, okay? So we talk about this over and over and over again, that stress and chronic stress ups body fat, reduces muscle mass. Why? Because your body's your best friend. Life is a marathon. And so if you're on a really long marathon and your body feels more stress, the last thing it wants you to do is get hurt. It wants you to reduce your metabolic rate so you can survive with less. So what it does when you go through menopause, adjustment of stress, is that your body will lower muscle mass and up body fat because one of its stress relief mechanisms is leaving it. Well, all you have to do is adjust and it gets better. So it doesn't mean that you have to feel this way. And it also doesn't mean that your body has like a moral code that once you go through menopause, you're just supposed to gain weight and just like roll with it. Some people will embrace that. I'm super excited for them. But some people are like, I don't want that to happen to me. I get that. Like it's not a moral, ethical thing that's going on. It's just a math problem. Do you have more stress? Do you have less stress? Is it going on? Balance your stress out, body gets better. So it's actually super easy. Now, the other stuff that goes through perimenopause is bleeding gets really weird, okay? And potentially kind of heavy and not the most enjoyable. So why does that happen? Well, when you think about your menstrual cycle, and I'm going to use a 28-day cycle just to make this easy, okay? So your brain, when you're starting, blood's coming from your vagina, is trying to tell your ovaries to wake up for the next cycle, right? So day 1 of your period is actually the end of the last cycle and the beginning of the next. So your brain is sending the little message down to your ovary or ovaries and saying, hey, you got to spit out an egg, okay? And so it's upping follicle stimulating hormone, or FSH, okay? Now in our ovaries, I think of them as bricks and mortar. So the bricks are the eggs, and the eggs make the estrogen, and then you have mortar that kind of makes the testosterone, okay? Now, the follicle stimulating hormone is stimulating the bricks. Now, for the first half of the cycle, what happens is you don't just have one brick listen, you have like 10 or 11 bricks listen, okay? So if you look at your ovaries at the first half of any menstrual cycle, you have lots of little follicles or lots of little circles. It's because each one of those little circles wants to be the one to spit out the one egg that month, right? Well, somewhere maybe about day 10 or day 11, one of those little follicles tells all the other ones that, man, it's rocking this, and they're gonna go away. So that one is the one that actually spits out the egg, and the other ones kind of die off. Now that little follicle gets to be about 2 to 3 centimeters that it pops open the egg, and then it closes off. So the egg is not flying down, it's fluffing down your tubes. And I kind of think of your tubes like in Nemo and the sea anemones, that they're going like this, because the fallopian tubes, I'm not joking you, I've seen many of them. They're like, oh, so I always think of Nemo trying to get, it's kind of funny, but anyway, I spent a lot of times with the fallopian tubes. So, but anyway, so the egg is going down. Now the egg can only live for about 24 hours-ish, and if it doesn't get fertilized, it dies. Well, the ovary still has that little cyst on it, right? And that cyst's job is to keep you pregnant once that little egg implants on your uterus if you get pregnant. And so it can only live for about 14 days. So it sits there and it waits for the egg to talk back to it to say, I'm here. Now, if that little cyst doesn't get any feedback from the egg that implanted because you got pregnant, it can't live anymore, and it kind of dies. And when it kind of goes like this, there's no support for the lining of your uterus, and you get your period. So for the first half of your cycle, you've got lots of little black dots. On the last 14 days of your cycle, you've got the monster bigger dot, okay? And that's the follicle. So, that's the mature follicle. So at the first half of your cycle, your ovaries make estrogen. Estrogen is like Miracle Grow to the grass. So I think of the lining of the uterus like a lawn, because I mowed a lot of grass in my life, okay? So estrogen is Miracle Grow. It makes the lining of the uterus grow. And that makes so much sense, because if the little egg's about to come out, you want this like really awesome grass to welcome in that beautiful little egg and just hold on to it and let it grow, okay? So then what happens though is the one dominant follicle makes progesterone, and progesterone is the lawnmower. So it kind of helps thin the lining out a little bit and mature it, okay? So you've got estrogen, which is Miracle Grow, and you got progesterone, which is the lawnmower. So for the first, for like 20 years of our life, we're mowing and growing and mowing and growing and mowing and growing. And then what starts to happen is that your eggs get a little different, okay? So what happens is that they just don't like to listen as good as we get to our mid and late 40s. And so your brain's like, all right, dude, game on, I'm gonna make you work. So it ups FSH, okay? Because it's trying to stimulate the follicles to listen. Now the follicles are like, ugh, and so what happens is sometimes they listen, sometimes they don't, and sometimes a few of them listen at the same time. So your estrogen levels actually go up a little bit during this period of time. And when that happens, the lining of your uterus gets thicker. But you don't ovulate as good because the egg isn't quite as great at this as it used to be, and so your lawnmower gets smaller. So just think about that. If you're miracle growing your grass and your lawnmower is tiny, man, that grass gets thick and your periods get really uncomfortable. And the thicker they get, the more uncomfortable they become. It just can become a little bit of a bloodbath at times. And so that being said, if you give people a little bit more lawnmower, then they don't have as much grass, they get more comfortable. Or sometimes they can put an IUD in, and I just tell folks that's like putting the lawnmower in mulch mode, so you really don't have a lot of grass come out and people get much happier. You can do an endometrial ablation where you burn the lining of your uterus, and then it can't listen to the Miracle Grow anymore for people who don't want to have babies anymore. So irregular bleeding in the perimenopausal period is super normal because it has to do with the health of the eggs and the mowing and the growing cycle, and it just gets off. So I think two important things. Oh, the other thing I would say is, yeah, we start getting hot flashes, and hot flashes come a lot at night, and sleep is important for your body to heal. So when you don't sleep, you get kind of grumpy. And sleep is one of the 7 things I tell people we all need. So that's a lot going on there, right? Your sleep is going away, you're having hot flashes, your stress relief hormones are going down, and your bleeding gets weird. That's a hard time. And then the other thing that happens with your beautiful ovaries is it's not like they just check out tomorrow. They work, they don't work, they work, they don't work, they work, they don't work. And so we start getting a little kind of bananas where you start wondering, did I feel good today because I ate chicken and had Jell-O? And then the next day you're like, no, it was the workout yesterday I did. And you start to try and pick out things of your day that are making your day better because you can't see what your ovaries are up to. But literally it has nothing to do if you ate chicken or Jell-O or worked out. It has everything to do with the hormones underneath that you just didn't know were happening. So you know what? We're here to make the world a better place. If we could do anything hormones are like so easy of your uterus. Your life is hard. Your uterus is actually super easy. Your uterus houses a baby and gives you a period. Those are the only 2 things it does. So if it's ever causing you a problem, don't let it. It's just like there's too much life to have. So and then the other thing that happens when you go through menopause, and gosh love it if I'm going too long and talking too much, let me know, is that as those hormones leave you too, sometimes you'll notice changes in your skin. You notice your hair gets thinner. Sometimes then our vagina gets drier. So if our vagina gets drier, that's uncomfortable. Because the other thing that happens is that our significant others, many of them still like to continue to have sex, right? And so as our sex hormones leave us and our vagina gets drier, our drive to have sex goes down, and then plus you have sex and it doesn't feel so hot, right? Doesn't have to be that way. So libido going down in a perimenopausal, postmenopausal time is not because there's anything wrong with you, it's because there's everything right with you. You're like super duper normal. The hormone that helps give you drive has left you, and nobody wants to do anything that hurts. So it's normal. Well, all you have to do is there's things you can do to fix it, right? So if vaginal dryness and discomfort is bumming people out, easy schmeezy. You could take hormones. You can give vaginal estrogen. There's other vaginal products that you can do, or you can even do the FemiLift. When I went through medical school, I used to think the only way to the vagina is hormones, but now I know you can laser it and it responds like our skin. So that is just super cool. And it's really nice to know that people who can't take hormone therapy for some reason don't have to live with a dry vagina, such as those people with a history of breast cancer. You don't have to feel that that part of your body is not okay. It's an epithelium. All you have to do is laser it, and it like super works, and it's really fun. Just like it's so fun to be part of people when they're changing their body composition, or they feel better when they take an antibiotic or a probiotic. And then they also, their labia doesn't itch when they have lichen sclerosis. It's so exciting for people to come in and say, oh my gosh, it works. They send us smiley faces after they have sex like, yeah. And we're just super pumped to be part of that journey with people, So that's another thing that happens is our vagina gets drier the further out And the other thing that happens sometimes as the vagina gets drier is we have more stress urinary incontinence. Why the heck, what is that? That's like I jump and I run around and I feel like I leak all the time. Well, you know why that happens is that the vagina is getting thinner, and look, I can't believe it, we have a straw. You know me, my straw for the urethra. Okay, so when you think about the vagina is just sitting underneath the urethra sits on top of the vagina, okay? So when we're youthful, our vagina is nice and thick, but as we continue to walk on this planet and become postmenopausal, well, our vagina gets thin, right? So our urethra, if it's sitting on top of it, can move, and if it moves, you leak easier. Well, all you have to do, if you thicken the vagina back up again, like with a femilift, it doesn't move as much. So it's super fun that with no surgical procedures and no hormones, you can also help you not pee your pants if you want to work out or run around or jump up and down or laugh really hard, because gosh knows it, everyone should laugh. So that being said, those would probably be some of the biggest concerns and complaints I get from people in the perimenopausal, postmenopausal people in period. And just to let you know, you totally don't have to suffer. There are things that you super can do. Yeah. So I wonder if I don't know if we have time for questions, or maybe anyone had questions. Are there any questions on there? Nope. Okay, cool.
All right.
So
we do want to mention why we're wearing our hats today. And we're wearing our hats today just to let you know that we still have, it is freezing, and we still have some of our hats left. If people want to get awesome headband, awesome hat, we still have them
super
in the front.
comfortable.
And if you want some lip gloss, obviously use your lip
really
gloss.
good.
And we are going to put on social media the switch in the ads, or the switch in the discounts that you would get if you went to the bridal show, got your lip gloss, and got a color. So look and stay tuned for those on Facebook and Instagram. And the last thing we want to do in terms of winners is we need to pick our IV therapy winner from our giveaway, because our awesome interns, they just did such a good job with this and got a lot of folks excited about IV therapy. So we'll let Sam.
This is a big day. I really get to choose.
You get to pick. And we'll also post this winner on Facebook and Instagram.
Should I name it out loud?
Mm-hmm.
So, Kaylee Johnson. Yay! Yay for you! We're so excited. You're going to feel like so much more nutrified, and a lot of times you just feel a lot more energy and you feel good. So congratulations. We're super excited to meet you.
And thanks everyone for entering and starting to follow us on Instagram. So be sure to share and like our video. We've invited a lot of folks to like our page, so feel free to find us on Instagram and on Facebook. And I think that's all the fun that we have for today.
And I think next week, Craig from Orthomolecular is going to be here. He's our first other guest besides Lauren and myself on our Facebook Live. And he's super fun. So if you have any questions about any supplement, he's so wise. I just love listening to him. So just be sure, you can even email in this week with him, and we'll be sure to try and stump Craig or ask Craig a whole bunch of questions.
And we're starting a podcast. So if you have podcast ideas or things you'd love to hear us talk about, please let us know.
Yes. So you have a great day, and thanks for watching.